We're live.
All right, good afternoon, everyone. Welcome to the Judicial Proceedings Committee. Today is January 25th, and for those keeping tabs at home, we have 77 days until sine die. Today, we have a briefing from our Department of Corrections and Department of Safety. We'll deal with issues, everything ranging from COVID in the prisons, some of the Women's Prerelease Center, and a myriad of other issues pertaining to corrections and detention. So our agenda will include a presentation at the top of the hour from Secretary Green. We have Carolyn Scruggs here, the Assistant Secretary of Programs, Treatment, and Reentry. We have, I see Rachel Sessas here, the Chief of Staff. We have Ann Harvey, Commissioner of Correction, and we have Michael Resnick, the Commissioner of Pretrial Detention and Services. And from the Department of General Services, we are joined by Nelson Reichert, which is the Deputy Secretary. We have Courtney Lee, the Director of Operations, Design, Construction, and Energy. And from the Maryland Correctional Administration Association, we have Ms. Marianne Thompson. She's the President. Welcome. And from State Correctional Facilities, DPSCS, we have, I think that's it. I think that rounds us out, right? Is that right, Sandy?
Yes.
All right, excellent. So with that, we'll start off with Secretary Green. Again, thank you very much for joining us. Look forward to having a candid conversation back and forth between the members of the committee and the members of the staff here. So thank you for being with us. Mr. Green, I'll unmute you here and the floor is yours.
Very good. Good afternoon, Chair Smith, Vice Chair Waldstreicher, and members of the Judicial Proceedings Committee. It's good to see you this afternoon. For the record, my name is Robert Green. I'm the Secretary of the Department of Public Safety and Correctional Services. With me today, as noted by the chair, is Chief Sessa, Commissioner Harvey from the Division of Correction, Commissioner Resnick from our Division of Pretrial and Detention Services. We give apologies on behalf of Assistant Secretary Scruggs. She was unable to be here today due to a family emergency. But joining us, Mr. Chair, is the Deputy Secretary of Operations, Mr. Wayne Hill. So again, thank you for having us. Next slide, please, slide 2. Today, I'm going to provide a brief update on the department's response to COVID-19, youth and restrictive housing, substance use disorder treatment, and women's pre-release as requested by the committee. The department's priority continues to be and has been mitigating and treating COVID-19 while we seek a new normal in terms of operations programming and reentry. Our first case in our department was of March 29th in 2020, and it has been an extremely long and prioritized journey for us. The safety and security of the dedicated men and women of the department and those that are remanded to our custody, the incarcerated population, remain and will continue to be an absolute priority for us. As a matter of operation under COVID-19, our departmental-wide leadership COVID-19 team is currently meeting 3 times a week, but often daily. And many times through this pandemic, twice a day or any time necessary to continue the communication channels and coordination as we went through this. Before I delve into where we are today in this prolonged battle against COVID-19, I'd like to take just a moment to update the committee give you a few updates as to where we are from a population management standpoint today. Next slide, please. In 2019, the department experienced a population decline of approximately 2% between January to December, and is indicated by the blue or top line. In 2020, the department experienced a 16.4% decrease in our population, as indicated by the yellow or middle line in the graph. And last year, the department experienced a slightly more than a 4% decrease in 2020, evidenced in the bottom line. Overall, the population has begun to stabilize, yet we remain approximately 16% below pre-COVID numbers. Next slide, please. The department is taking extra precautions to ensure successful reentry and connection to community resources while also limiting exposure to COVID-19. We've remained and will continue to be extremely diligent in our testing, providing the required use of personal protective equipment, and providing vaccinations and testing again across the system. I don't know of any other state at this moment in the country that is doing the amount of testing that we are within the state of Maryland. We want to know what's occurring in our systems, and testing has been the key for us across our many facilities of confinement. The department continues to conduct weekly testing of all unvaccinated staff and all contractual personnel as well. And the department is also requiring weekly COVID-19 testing for staff at the Baltimore City Booking and Intake Center, as well as the Chesapeake Detention Facility, regardless of vaccination status. Rapid tests are being administered to incoming detainees, and PCRs are being administered to newly committed individuals. We've continued well over a year now the process. Every individual entering Commissioner Resnick's system goes through the testing tents there before they even enter the building. So we have an idea of where this individual stands with COVID-19 before coming into our structure. It's been a very successful collaboration for the department and our colleagues at MDH. Next slide, please. The graph on this slide not only shows the volume of tests we've administered, but it also shows correspondence to the community and statewide positivity rate over time. I would note to you this is available as information is available part of our standard COVID-19 reporting on our dashboard. But as demonstrated by this slide, the department's population has remained under the community and statewide spread throughout a majority of the pandemic. This has been a measure that we closely watch across all regions. This is one of 5 visuals included in our public dashboard that is published on our website every Friday to reflect the prior week's information. Again, doing it on Fridays allows us to keep it up to date because information just changes daily. Other material on our dashboard includes incidents of COVID-19 by institution, cumulative cases by institution, population testing, vaccination and booster updates, including first and second dose administered and refused vaccinations, as well as booster doses. The department's dashboard has been publicly recognized as one of the more comprehensive reporting and updating of the specific data that individuals are interested in and want to know in our communities. We note that only 2 states, Maryland and South Carolina, are publishing the number of incarcerated people who've also refused the vaccination. Next slide, please. Speaking directly of vaccinations, the visual on this slide is another taken from our dashboard. The department's contractual medical treatment provider and the Maryland Department of Health continue to make every effort to offer first and second and booster dose vaccinations to individuals incarcerated across state correctional facilities. It is an all hands on deck approach. Inmate booster vaccinations began November 11th, according to risk level stratification for medical need. And just 3 days after other state authorities, Pennsylvania, North Dakota, Utah, and other systems began doing the same. As booster eligibility was expanded by the CDC, we followed in kind, and on November 19th, the department began expanding availability to all inmates who were fully vaccinated. In December, the department began providing an incentive package to the inmate population to obtain a booster. It mirrored some of our successful previous vaccination incentives in response to vaccination hesitancy among our incarcerated population. But I must note the most important thing that we did was provided continuing, ongoing, updated, accurate information to both those in our facilities, the staff that work here, and the families of those have loved ones in our facilities. Information absolutely takes the day. The rise of the Omicron variant coincided with renewed willingness for first and second doses of the vaccination, which we continue to do and will continue to offer in the future. As reported in this past Friday's update, we have administered 14,346 first doses, 13,350 second doses, and booster shots 2,770. Although we are aware that this coming Friday's release will place that number well above 4,000. Since vaccination clinics are held on a daily basis, those figures often lag a bit behind because they're captured in real time, and then the nature of getting those recorded and updated in our systems. Based on the number of clinics being held, we expect the reported booster figures, as I noted in this next report, to be well over 4,000. Next slide, please. Moving on to the other matter that the committee asked us to present on, youth and restrictive housing. The department is one of 2 states in the country where we run the local jails. And as you know, we run the Baltimore City Pretrial Complex. It is under the very able supervision of Commissioner Mike Resnick, who is here with us today. The Youth Detention Center, which opened in 2017, houses those individuals under the age of 18 who have been charged as adults and are either waiting for their trial or are serving a sentence but are under the age of 18 prior to then transferring into DOC, Division of Corrections, if applicable. Next slide, please. This slide simply lays out the existing law that governs placement on youth restrictive housing. And as you can see, the Correctional Services Article 96141 specifies that there must be clear and convincing evidence as determined by the managing official that a minor presents a risk to self or others or to the security of the facility. However, the Youth Detention Center does not utilize restrictive housing. Next slide, please. This slide simply highlights the population trends at the Youth Detention Center that we thought you may find of interest. The population increased steadily in 2020, declined between January to May 2021, and has been increasing since May of 2021. There were no youth placed in restrictive housing in fiscal year 20 or fiscal year 21. Next slide, please. Next, we were asked to provide the committee with information regarding substance use disorder treatment. This slide highlights a couple of the substance use disorder treatment programs within the Division of Corrections and the Division of Pretrial Detention Services. The department uses a multi-vendor, multidisciplinary approach to provide medical and mental health and substance use disorder treatment. As well, we have both full-time and contractual providers. We actually submitted a contract to the Office of State Procurement yesterday, which we hope will be approved by the Board of Public Works and will massively expand substance use disorder treatment across our department. Next slide, please. The slide highlights our medication-assisted treatment program across the department. We utilize methadone maintenance for the pretrial population, and we've also partnered with the Behavioral Health Leadership Institute to provide Suboxone within the city. Through a partnership with a senior research scientist, the department has offered naltrexone to the incarcerated population prior to release now for over 5 years. I'm also proud to say that this past year, the agency has included the Division of Parole and Probation and have been designated and recognized as an overdose response program. Next slide, please. Of course, I would be remiss if I didn't acknowledge our social workers and other staff, case managers, reentry workers, and everyone who contributes to the treatment and programming of our population across the department. Hardworking, very hardworking staff that have provided without interruption reentry services, connectivity to providers within the community prior to release, and have just done a stellar job under challenging at best circumstances. Social workers also hold cognitive behavioral group treatment and short-term solution-focused individual treatments, to name a few. Next slide, please. The last topic that the committee asked us to brief on is the Women's Pre-Release Unit. As noted in the agenda, I believe we have a leadership from the Department of General Services joining us today virtually to assist in answering any questions on this topic. I'd just like to start out by noting the trends in the population and highlight some of the programs and services provided to the women incarcerated in our system. Beginning of the presentation, I shared with you a graph illustrating the decline in the incarcerated population as a whole. The women's population has seen the sharpest decline. From fiscal year 2015 through fiscal year 2021, the total number of women incarcerated within the Division of Correction has fallen by over 50%. As of January 18th, the Maryland Correctional Institute for Women houses a total of 492 individuals, 62 of which are classified as pre-release. Next slide, please. Thank you. The women participate in a myriad of programming, including occupational training opportunities, one of 3 programs that are operated by MCE, sewing program, a data entry, and an AutoCAD program that is focused on drafting and design. In addition to the education programs offered via the Department of Labor, this facility also has the opportunity to participate in the Goucher Prison Education Program. Labor programs extend beyond the GED and include certification and pre-apprenticeship programming as well. Next slide, please. While I will be providing an update specific to the implementation of Senate Bill 684 in just a moment, we're excited to announce the establishment of another initiative at the facility, specialized reentry housing unit at NCIW that will be focused on reentry populations. This unit will house only individuals who are within 24 months of release and will provide additional reentry services to meet the needs of this particular population. Our desire, our aim is to have this program completely operational this summer based on COVID restrictions as we know them today. I also thought that it was important to note that our partners at the Department of Labor don't just provide educational services, they also provide a multitude of other occupational and vocational services, as does MCE. Next slide, please. Specific to Senate Bill 684, which passed during the 2020 legislative session, it requires the department to construct and operate a standalone pre-release unit for women. The location of this new prison is based on zip code. The largest percentage of women are slated to return home to in definition. Case managers and reentry team work diligently on developing and verifying home plans for every incarcerated individual across our system. However, these home plans change over time and based on changes to the estimated release dates due to the accrual of diminution credits, parole determinations, and other sentence modifications. Not to mention that there's a changing dynamic of family and support system within the community. In terms of the actual planning, design, and construction of this new facility, the Department of General Services is responsible for construction-related services in excess of $200,000. Just to give you some perspective, the Youth Detention Center, which is a 60-bed facility and is our newest facility that opened, cost approximately $36 million. And that was well over 5 years ago, just to give you a comparison in terms of potential costs. The fiscal year 2023 budget does include funding to begin the initial plan, phase 1 planning of the facility, and we'll continue to work collaboratively with our DGS colleagues on this project. And as noted by the chairman, they are here today as well. Next slide, please. Another component of our dashboards on our website, this shows the home plans of our projected releases, which can be filtered for anyone viewing them by age, race, and gender. And as you can see, the fiscal year 2022 projection is that we will release 58 women who are incarcerated within the Division of Corrections. 27% had a home plan located in Baltimore City at the time the dashboard was published. Nearly 12% had a home plan that was located in Baltimore County. Another 13.5% had yet to identify where their home plan will be. So if they identified a home plan in Baltimore County, then that percentage would increase to over 22%, just as a demonstration of fluidity of going home and making those plans for people. We will continue to monitor this data. We'll include it in the planning process of the new facility as required under Senate Bill 684. I would say in conclusion, I'm just immensely proud of the men and women in our department, the work that they have done, and their focus on the priorities of maintaining the life safety of all committed to our custody. And with that, Chairman Smith, that includes my formal presentation, and we are available for questions.
Excellent. Thank you very much, Mr. Secretary. And as we discussed at the top we look forward to having a fruitful and a candid discussion on the topics covered today. So I wanted, if committee members may, I'd like to go in order. So if you've got questions, COVID, youth restricted housing, medication, some of the social work opportunities provided, solitary confinement, the pre-release center, let's try to keep them kind of clustered together, because I'd like, if possible, Mr. Secretary, if you need to reference or rely on some of the materials that you presented, that we can kind of go in sequential order. It might be a little easier for us to organize our thoughts on our line of questioning. So excellent. If folks of the committee have questions relating to COVID, COVID in the prisons or in the system, I would ask those folks to go ahead and raise your digital hand. All right, I've got Senator Carter is up. Senator Carter, go ahead. And then we'll go to Senator Hedelman.
Thank you, Mr. Chair. And thank you, Secretary Green. Quick first question. I just think I might have missed it in your presentation. The number of vaccinated at just over 14,000, out of how many?
14,000 of the individuals. As you know, the DOC as well as the pretrial population, Senator, continues to turn over. We have individuals that are released and more individuals that come in the door, and that is a running total since we began the process.
And once it seems that you are doing as much as you can with regard to testing. Once individuals are tested and found to have COVID, can you just clarify what the process is for treatment of those individuals?
That is an excellent question, Senator Carter, and thank you. We have established across our system, we often refer to it as the bubble. So the intake, testing, and quarantine. I would use it as an example at BC Beck with Commissioner Resnick, who is on the call. If an individual is found to be COVID-19 positive, we're going to establish an isolation unit where those individuals are going to be housed, treated, monitored, and then go through that prescribed waiting period and come out of that facility, that testing isolation area into general population. We have that existing all across our system, whether it be in a prison system in the far west. If individuals are found to be COVID positive, then we have isolation. We have treatment areas. Of course, we utilize local hospitals, all based on what the prescribed need of the individual is. I would refer to probably looking at a facility as almost a bubble inside a bubble, testing our staff coming in. We know we're the vectors. We know that the vectors of how things move. We have housing units, multiple housing units, Senator Carter, that don't come in contact with each other so that we don't cross-contaminate. And it's become a very complex amount of movement. And we're also well guided by MDH and how we do that. But whatever the prescribed treatment is, whether it be that is the community standard, we're going to engage that in maintaining that person.
Thank you. And last question, Mr. Chair. With regard to masking, how are you doing with mask distribution? I have received a few complaints from families about the idea that inmates are forced to use the same mask for long periods of time. I know that there may have been some issue with the N95s, but at this point, you should have, do you have adequate masks, and are you able to give inmates fresh masks on a regular basis?
Absolutely, Senator. Again, thank you for that question. We're issuing the population, the incarcerated population, a cloth mask. We started doing that a long time ago. I believe we're in the 7th cycle of replacement of that, but we can get you the exact number that we have issued. We've also started providing surgical masks to the population so that they can double mask with that cloth mask. So those surgical masks are on a 7-day rotation under the leadership of both commissioners, making sure that we're getting that out. We've offered to our staff and require our staff to, at a minimum, wear the surgical mask. We've also provided all of our staff the opportunity for a KN95 and obviously N95s that are available in all of our areas where we have identified cases. We have a good supply We've been fortunate to maintain that and make that readily available. And I would tell you also, Senator, our leadership team's presence in the facilities, making sure that that happens, making sure we're getting it out, making sure that we're talking about masking compliance is really, really important. But we are fortunate to have a good supply. I also attend all of the LMRCs with our union colleagues. Was just recently on an LMRC where if there is a blip on the screen with that, we know about it, and none around masking in the last 2 weeks, Senator.
Is it possible, like if an inmate has a need to get an additional mask, or like they need a clean mask before 7 days is up, they could possibly get one? I know I don't like to wear my mask, more than 2 days, and it's not even 24/7 that I've got to keep it on. So, there could be issues that come up where your mask gets dirty or you don't feel it's sanitary anymore.
Senator, I'd like to open up the conversation also to Deputy Secretary Hill, who's been just a very strong leader of this in our facilities. But we're going to offer masks for individuals as we have supply. We've got to be cognizant of supply and how we get that out. DSO Hill? You're muted, sir.
I'm trying to unmute him. There you go. For
Can
some
you
reason,
hear me now?
your name is Chris West under there, so we'll go ahead and change.
Senator Chris West. You didn't tell me, DSO.
Gotta have some secrets, sir. Yes, ma'am. We do allow for exchange if we understand that masks may get damaged or dirty. And now on those occasions, we do replace those masks if we see that there is a need. Yes, we do provide more than one.
Excellent. Thank you. Senator Carter, is a thumbs up? You good to go? Okay, excellent. We'll now move over. I saw Senator Hedelman and then Senator Sidnor and then Senator Watson. So Senator Hedelman, you're up.
Thank you very much, Mr. Chairman. I'm going to follow up on the COVID line of questioning, if I may, Mr. Secretary. Thank you for being here. We read a number of weeks ago in the Baltimore Sun about some concerns about a private company, I think out of California, True Care, who had, there are some suspicions about the way their vaccinations were handled by certain state practices. And a number of those vaccines were to go to people who are incarcerated. And I just would like to know kind of how you found out about it, how many people may have received vaccines that weren't up to the safety standards, the handling that we expect. And then what has been done with the people that you have identified? Have they been revaccinated? If you could give us an update on what has happened with those people, I would appreciate it. Thank you.
Thank you for that question, Senator. Absolutely. So there were 135 individuals that were in our custody that were identified. We received that information on Thursday, January 6th. So we immediately began to go through our processes to identify the individuals in our system, where they were, what their status was. We had some that had already been released. We had individuals that were currently with us. We had individuals that would need to be revaccinated. And then we had 11, I believe, individuals that have been released to DPP. And we have been successful at contacting all of those individuals. Revaccination has been offered to those that desired it. We were given a letter of communication to provide to those individuals by our colleagues at MDH. And as of me speaking to you today, we believe we have one individual that we have not yet contacted who absconded from our Division of Parole and Probation, and we are actively seeking that person for 2 reasons.
Okay. Thank you very much. And are you aware if there are any people who have tested positive for COVID in that cohort of people?
I am not, Senator, but we can take that question and potentially run that data back for you and get back to the committee.
I would appreciate it. Thank you. Thank you very much, Mr. Chairman. Thank you, Mr. Secretary.
Thank you, Senator Hedelman. We're going to go to Senator Sidnor. Do you still have a question? Excellent, you're up. And then we'll go on to Senator Watson.
And good afternoon, Mr. Secretary. I just wanted to confirm, you said 135 people were identified. Those are the people who were identified that were administered the compromised vaccination or the vaccine?
There were 135 that were reported to us that came out of that, I'm going to use terminology, batch. That was, we were notified of by our colleagues at MDH within our system, and we actively pursued that 135 individuals.
And is True Care 24, I guess they still have the contract and they're still doing the vaccines within the system?
We have multiple vendors that are doing vaccinations with us with MDH. I must tell you, I'm not sure who today is working with us. But I know we're doing some through MDH as well through our contract provider as well.
Could you, I mean, I heard.
We'll get that information for you, Senator. I just don't want to misspeak.
No, I appreciate that. And what I don't recall, and maybe you could help me, the compromised vaccines, what is it that True Care did or didn't do? And if there's something that they didn't do, have protocols been put in place so that this doesn't happen in the future?
As I understand it, Senator, had something to do with temperature controls, but I am not the expert there on that. I know what we do when we receive vaccinations and how to handle them, but I could give you, and we'll get to you, the clinical or the medical facts of what they believe happened with that batch or that group of vaccinations. I'm happy to provide that to you.
And one last question was, how many of, I know you said there were 11 people released, 135 identified. Now, how do you know how many were revaccinated?
There were a total of 135 in the total. The 11 were individuals that were under DPP supervision. Chief Sessa or any of our staff, please, we have a number here that if you have a more granular number. If not, I'll make sure that you get that for you, Senator. But we pursued them all through our revaccination clinics that were in our custody.
Okay. Thank you very much.
Okay.
Good.
Good afternoon, Senator, members of the committee. Yes, I do have a lot of the information at hand, and Secretary Green was correct in terms of the notification that we received from the Department of Health indicated that there was an issue regarding the temperature at which those vaccines were stored at. And again, that they identified the 135 individuals that were administered the vaccine at the time from that batch. And in circling back to all of those individuals that were still within our custody of the Division of Correction, there were 83 individuals who initially indicated that they would like to receive an additional vaccination, and we expeditiously, through our partnership with the Maryland Department of Health, administered those additional vaccinations. Those individuals that were still in our custody also had to sign and acknowledge receipt of that letter that was produced and provided by the Maryland Department of Health. And that information was then uploaded into our electronic health record system for the incarcerated population.
And thank you, Senator Sidnor. Is that good to go? All right, excellent. We'll move on to Senator Watson, and I know that Senator Hedelman has a follow-up.
Thank you, Mr. Chair. Good afternoon. Secretary Green, always good to see you.
Thank you, sir.
Quick question for you. I'm interested in your current policy on quarantining incarcerated individuals who test positive for COVID. You know, if somebody tests positive, you know, what actions are taken? Are they put in restrictive housing? How do you mitigate mitigate what's occurring?
Thank you for that question, Senator. I think as I described, it's a series of bubbles inside the bubble. As you look at a facility, we have designated housing units that we separate individuals out to. There's an obvious restriction of movement with COVID-19, as you and I would when we are at home. So it is a medical restricted movement to make sure that we're not spreading the virus around our systems. We have housing units in each of our facilities that are designated for that. There were times in our system where if we had more cases than not, it could be multiple housing units. And we are still in a posture, Senator, where we have multiple housing units that just do not commingle with each other right now as we continue to move through this what is now the sixth wave of COVID-19 that we've experienced. So yes, sir, we would separate monitor, make sure that we're medically keeping an eye on them as well as with our staff, keeping an eye on each other.
So within the bubble, if somebody gets the more severe symptoms, how is that? Are they treated there on site? Are they taken to the nearest hospital? How does that happen?
We would engage that community standard of care, Senator. So we have infirmaries within our system. I believe, as I testified before this committee, we've been through many iterations of COVID-19. We had in Jessup region had a very large tent complex that was built at one point to help alleviate the crowding, potential crowding at hospitals. So we went through that iteration. That has since been demobilized because vaccines are doing what they're supposed to do, which is keeping people from getting severely ill. You would go to our infirmary. You may, if you were not symptomatic, Senator, you may would ride out your time of isolation. Again, as many of us have in our area, not moving, food coming to us, making sure that we're not spreading virus. And if you need to go to the hospital, we're sending you to the hospital. The hospitalization and the COVID wave for us, as you know, very early when I presented to you, many of you a year ago, our hospitalizations 10, 12. I'm pleased to say today we have 2 individuals that I believe it could change by the moment that are hospitalized in our system. But you get hospital level care and then you're released back into us, into our system and receive the level of care till you are well.
So do you have ventilators on campus?
We do not do ventilation. That is a level of clinical care that we do not do.
Okay.
Thank you for that question and that clarification, Senator.
All right. Thank you very much.
Do that level of clinical care on site.
Got it. Thank you.
Excellent. Thank you, Senator Watson. We'll move back to Senator Hedelman as a follow-up question.
Thank you very much, Mr. Chairman. Mr. Secretary, you said that you did not find out until January 6th that you had a batch of these potential tainted vaccines. Is that right?
That I believe is the date that I noted that we got the list of individuals to pursue them. Chief Cecil, you want to check me on that?
That is correct in terms of the, we received the notification with the letter to disseminate to the individuals that were identified as being in our custody received that batch. Those 135 individuals, the Secretary is correct in terms of that date.
Making sure we have the letter, Senator, and all the pieces that we needed to move forward.
Okay, and were you notified from the Department of Health or any earlier that this may have been an issue, even if you were not notified with individual names?
Senator, here's what I will tell you about, and very directly, thank you for that question. We have members of the Department of Health on our COVID calls frequently. Whether I heard about that or not prior to that, I must tell you, Senator, I don't recall. We were meeting frequently, continue to move through our cadence, but it has always been a level of very good communication with our representatives on that call.
Okay, I'm gonna.
I don't, Senator. I sometimes twice a day. I truly don't recall. But I know when we took that action and got everything we needed to go and make sure that we were going to re-engage those folks. That was January 6th.
All right, thank you.
Yes, Senator.
All right, looking around the committee for additional questions. And Mr. Secretary, I'll just do a broader question just in terms of just the general ebb and flow since COVID has we're still very much in the midst of it. How have your social distancing protocols evolved since the beginning of the pandemic? And more broadly speaking, does that result in folks spending more or less time, more recreational time, more time inside the cell? Can you give us an overview of what that looks like and how that's evolved?
It's certainly, Senator, and I think evolving has been the key word from beginning to end. Things like meal service, grab and go meal service, where rather than doing large dining room areas, you're going to go in groups, go get your meal service, bring that meal service back to perhaps a day room or a housing unit. I would tell you it evolves almost weekly with the again, the wave. Everything from barriers to having to stop group treatment, and group programming, education classes. 1 week or one 3-week period, Commissioner Harvey may have some groups back together, but we're doing classes for people that live in the same housing unit rather than bringing 6 housing units together and run any chance of that commingling. It is a daily evolution, and it can absolutely, Senator, result in more in your housing unit time, more in your cell time, if that is an area where we're seeking to quarantine and keep people healthy. And that has been the cadence, but it has always been our desire at the moment possible where we can safely do so, getting people outside in larger groups. And again, we remain in lockstep with MDH. How many should we have moving? We have been afforded the wisdom of Dr. Mitchell from MDH, the epidemiologist. I don't know of how many facilities have had an individual of that magnitude assigned to us, but that's how it's ebbed and flowed. And Chairman, I would be remiss if I didn't also, if you don't mind, acknowledge my colleague, Mary Ann Thompson, representing all of the local facilities. They've had a great deal of challenge. We've worked closely with them. When you talk about PPE, there were times that if our local colleagues needed PPE, we were there. I give Ms. Thompson great credit where we established also a bi-weekly COVID-19 meeting between the state and every local correctional system. And we discussed the very things that you're asking us about today, Chairman.
No, I appreciate that. And I know the situation's been fluid and things have evolved, but I guess I'm more interested in the pre-post COVID. So now, generally speaking, are folks spending more time, in their cell or isolated now than before? And do you all track cell time? Is there a way, do you all have that type of granular data, how often or how long a particular inmate is inside of their cell as opposed to engage in whatever other activity you've got going on?
Yes, Senator, we track it every day in terms of getting individuals out of their cells, getting them to showers, getting them to meal service, getting them programs. I think this committee knows from me that I've never hidden the fact that I'm extremely program oriented. I am focused on people changing their lives. But during these last 23 months, the focus has been saving lives. And if I may, I have Commissioner Harvey on the phone who manages those state facilities, and Commissioner Resnick. And if there's anything you'd like to add, please, Commissioner Harvey.
And then before that, just bottom line up front, if have folks been spending more time in their cells post-COVID than pre?
Absolutely,
yeah.
Yes, and during. Absolutely. More. There are times they are in their cells more. Absolutely. Over the last 23 months, more in cell time than I would want under extraordinary circumstances with positive outcome and saving lives, Chairman.
I understand. Appreciate it. If Ms. Harvey or Mr. Resnick, if you'd like to chime in, the floor is yours.
George, just to follow up on the Secretary's comments, in our system in Baltimore, we have a lot of dormitory style housing where there are no cells. So, we can't confine people to a cell, but what they do is they stay in their housing unit with their, the group of inmates who are assigned there with them, and they don't mingle with other housing units. So they'll move to dining hall to grab and go, they'll move to rec yards just within that housing unit. So they stay insulated after they've already been through our quarantine periods. And we do test, and we do give, we've had, as the Secretary mentioned, the vaccine program. So our inmates are housed together in their congregate areas, and they move together and they stay together. They don't intermingle. So that's why a lot of them get to stay out of their cells for periods of time. But in the areas where we just do not have cells and only dormitory housing, that's how those units are managed. They just don't mingle.
I appreciate that. That's very helpful. Thank you for that. All right, looking around the committee for additional questions on COVID. All right, we'll now move on to, I'll go through the subject matter in the sequential order that the Secretary's presentation went. If you have a question, just raise your hand and we'll stop there, okay? So youth restricted housing. Seeing no questions on that. Medication assisted treatment, covered enough of that. All right, social work opportunities, programming. All right, let's go to the Prerelease Center. Questions on pre-release? More questions? As people that solitary confinement. All right, hold on. Let's go back. Senator Carter, go ahead. Which subject matter do you want to jump in on?
Thank you, Mr. Chair. I'm sorry you were going very fast.
Sorry.
Oh, can you hear me?
Yeah, we can hear you. Yep.
Oh, quick question about the drug treatment or substance disorder. You said that you have, sounded like you had some treatment available, but so do you have a situation where you have treatment on demand, or what's the criterion that one meet? And then would you say that you have comprehensive substance abuse treatment? And then finally, I'll just throw this in there. What about efforts to stop the influx of illicit substances in the institutions? How is that going? And have you had a lot of problem with that of late?
Senator, that is a myriad of excellent questions. Thank you. So I'm happy to answer those. I think this next matter that is before the BPW that we placed before them yesterday will get us to the point of comprehensive substance abuse services. Do I think we have them today? No, we know that we don't have what we want. We know where we want to be. And again, this contract that moved forward, it is, if approved and moves through the Board of Public Works, will open those doors to get us, I think, closer. I want robust substance abuse treatment within what we are doing. From everything that we are able to do in the last 23 months, it has been prescriptive. It has been everything from small therapeutic groups to individual counseling. We have a tablet-based program that's going to allow for a little bit more of personal one-on-one engagement for the population. It is not where I have wanted to be, but I am confident that this matter before the board is going to begin to get us there. It's a very robust contract. As this committee may recall, there was a RFP that was right at the beginning of COVID. Had we awarded that RFP, we would have not been in a position to provide services because we needed a very robust, broad ability to reach individuals wherever they were. That would not have accomplished that. And we believe the future contract that went to the BPW yesterday will help us do that. I am very excited. I think the other piece around that, Senator, is community programming. And our communities, as we have suffered inside the facility with loss of service due to having to slow our movement, as has gone the community. And our social workers really working diligently find connection to service, connection to that next step beyond the walls. And I believe we are going to we'll persevere at the end of this, but there has been a slowdown in all of those dimensions. The final piece around illicit substances coming into our facilities, we take a very concentrated effort around that, focusing on every intoxicant to include alcohol, which can be manufactured, and making sure that we're keeping that out of our facilities. We're maintaining, we have concentrated teams that go and look and find. While I'd be remiss to tell you that individuals have become very creative during COVID and have and how and what those methods of delivery are. The group that is with you today has done a pretty stellar job, but it is an everyday fight to make sure we stay ahead of that. We actually have figures around that, which we have, we track that. That's data that we track. So that's the long answer to a number of questions. Hopefully I've covered them, Senator, for you.
Have you do you feel like you're able to have adequate oversight over employees, staff, and correctional officers potentially bringing in contraband that should not be there at this point?
That's always been a focus of this administration, the corruption, making sure that we don't have bad coming in the doors, making sure that we're doing that which we should and maintaining the integrity of our system. And I believe we do a very good job of that, Senator. I am extremely proud of the men and women that do this work. And while we will have those that choose to destroy their integrity and do things that they should not, it is by no means a reflection on the totality of the individuals that are doing the work here. And again, that is an everyday mission for us that is sometimes less seen, but it is a concentration for our leadership.
Thank you. And Mr. Chair, are we still on this, or are we moving forward to the next categories?
Moving forward to the next categories. So I've got, for me personally, I've got a number of questions on the pre-release center and that process, which the secretary started us off with. So that's all I've got personally, but I want to head off to Senator Sidnor. Did you have follow-up questions on this subject matter? You would like to toggle to the next? All right, let's go to Senator Sidnor, then I'll come back to you, Senator Carter. Senator Sidnor, go ahead. I'm going to unmute you here. Go ahead.
Thank you. Sorry. With jobs and job training, was that one that you called out?
It was, yes. So go ahead. We'll move on to that.
All right. Mr. Secretary, just you could touch on what job training programs were available for men and women in pre-release status?
Job training, Senator, I want to make sure I answer your question appropriately. Specifically to pre-release individuals?
Yes, sir.
We do pre-release plans on every individual in our system, whether they ever reach the designation of a pre-release status. We have individuals that are being released from our medium, minimum, maximum security facilities. So we're doing pre-release preparation across the board, always focusing on job training. Job training, whether it be through MCE, which is just an incredible enterprise of ever evolving job skill, or we're concentrating on that through our Department of Labor. But again, Senator, I don't mean to sound like a broken record, but all of those things have been dramatically affected by the last 23 months, and we look forward to the day where that will not be the case.
And Senator, if I may add, in terms of our partnerships with the Department of Labor, as the Secretary referenced, they actually have 25 occupational training programs across our system, courses running from 200 hours to 600 hours in length, including things like barber stylist program. And I know they've got excellent annual reports about the services that they provide in terms of occupational and vocational training. And just to kind of give you a reference point from a 2019 or more normal year, if you will, they serviced over 4,750 students throughout our state correctional facilities, again in 2019, and over nearly 400 individuals earned their GED. So a lot of great data that is available through our partners at the Department of Labor, and hopefully that provides you with a little additional information.
Oh, and I guess in order to access job opportunities and things, they would have access to computers and the like. I guess your facilities have the Wi-Fi systems and things so that people could access those jobs with the computers and the like.
Thank you, Senator. And our last education meeting with Secretary Robinson, that actually came up, and having a device and a piece of software in place that will allow certification testing that is on site and allow, if you will, different programs within our secure window. So yes, sir, that is in play across our system. We're trying to just take advantage of every opportunity.
And that's for men and women, right?
Yeah, yes, Senator.
Great. Okay, thank you.
Thank you, Senator Sidnor. We're going to go to Senator West and then Senator Hellman. Senator West, you're up.
Thank you, Mr. Chair. Can I be heard? Okay, good. So I think this is the place for me to ask the question I had from the beginning. About 5 or 6 years ago, I was on the task force that produced the Justice Reinvestment Act. The whole theory of that was to take nonviolent offenders and to break them of a drug habit if they were on drugs, and to give them vocational training, and then to get them out of jail into jobs so they could lead productive lives. I don't think I've ever been invited to a debriefing on how that is working. So we're now talking about job training, which really plays right into justice reinvestment. Have you ever put together information that could be supplied to those of us who formulated the Justice Reinvestment Act, so we would know how that act is playing out in real time?
Thank you for that question, Senator. The Justice Reinvestment Oversight has JRI has a Justice Reinvestment Oversight Board, a group that meets on a regular basis, and I could absolutely get you some of the presentations, have them available to you of that group that I believe we meet. I have a lot of meetings, Senator, but I believe we meet quarterly at this point.
That would be great. I'd be most interested in taking a look at the information being supplied to that group. Thanks.
And if I may, Senator, we also submitted a joint chairman's report as a part of the FY 2022 budget cycle that was shared with the budget committees that we'd be happy to get you a copy of.
Good. Thank you so much, Rachel.
That'd be excellent. Thank you very much. All right, Senator Hettleman, go ahead.
Thank you very much, Mr. Chairman. Mr. Secretary, you mentioned having access to educational programs and job training programs. And I wonder if you can tell me whether there are certain parameters about what kind of person who is incarcerated has access to them. I recently heard about someone being told that they couldn't access an educational program because they were too close to their time of release. And I'm a little unclear as to kind of what those parameters are for access to those programs.
Thank you for that question, Senator. If I may ask if we can get those different parameters for the various programs from our colleagues at Labor and share those with you across the board. I know there's testing criteria, perhaps time to completion criteria, a prerequisite, and we can provide that to you from Labor across those programs, if I may, Senator.
Is that for educational programs as well?
It would be education programs. I'm sure that the prerequisites exist to get into various levels. Obviously, a college program, having had the basic GED or the ability to succeed in those programs, but we can give you a myriad of detail around that, if I may, Senator, around each one.
Thank you.
Excellent. Thank you, Senator Hettleman. Looking around the Zoom room for additional questions, I don't see any, and then I'll just head right into the pre-release questions. And Mr. Secretary, we've had this conversation before, and I know that a lot of confusion amongst committee members, and just wanted, so the next line of questions, just to kind of flush that out. I know you touched on this in your presentation. So obviously the legislation we passed in 2020 set forth 3 primary benchmarks for the Prerelease Center, and that was one was to let's grab it, let's identify a location, acquire that property, get the site plan and design set up, begin construction or renovation of a facility that was selected, and that benchmark that was supposed to happen by September 1st of 2021. And then third, it was to begin operating and providing services in the pre-release facility on or before June 1st of 2023, obviously about a year out here now. So just can you walk us through exactly, where we are and in that chain, because obviously some of those benchmarks those dates have been blown. And so just want to provide more context on that. And then I've got a couple other questions to kind of just help us understand where we are in the process.
Very good, Senator, and thank you for that question. Senate Bill 684, as you know, requires the department to construct and operate a standalone pre-release unit for women. That bill was passed by the Maryland General Assembly on March 18th of 2020. The bill was then vetoed by Governor Hogan on May 7th, 2020. The department's budget is submitted each year to DBM in the fall for the next fiscal year. So the fiscal year 2022 budget would have been submitted in the fall of 2020. Since that bill had been vetoed, there was no funding that was included in fiscal year 2022. The legislature overrode that veto February 11th, and in the fall of 2021, the department submitted its budget request to the Department of Budget Management, which did include $150,000 the first possible opportunity to begin the phase 1 planning of that project. So on October 21st, members of our team did meet with the Commissioner of Corrections, Deputy Secretary of Operations, met with Out for Justice and the Job Opportunities Task Force, both interested parties in this facility about Senate Bill 684. And at that point, we were unable to note to them the budget, but as you will see in fiscal year 2023, that money has been included. My colleague Nelson Reichert from DGS is with us and perhaps add more context about phase 1 planning and the movement of a project through state budgeting.
And the money that's allocated, just to be clear, is the $150,000 for that initial tranche of
the $150,000 for the phase 1 planning document.
Got it. Senator Huff, I see you there. I've got a couple more questions and I'll kick it over to you. I just want to do just a couple more background questions, but I see you, Senator Huff. Mr. Resnick, go ahead.
I was asked to unmute. I don't have anything to.
Okay, excellent. Hey, sometimes it happens. All right. Again, Secretary, back to you real quick for, again, just some foundational background level setting questions. So property acquired for the Release Center?
There's been no property acquired. We've not completed the phase 1.
Got it. This is all just foundational for the record here. Designed a site plan for the women's pre-release facility?
No, the money has just been placed in the budget, Senator.
150 is still just in this year's, but in the FY 22 budget, right? Or 21, sorry.
Fiscal year 2023, Chairman.
Sorry.
2023, Senator.
There you go. All right, I've got another kind of crop of questions, but Senator Huff, are you still, I'm gonna go ahead and kick it over to you because I'll come back.
Yeah, thank you very much. Secretary, I'm interested, what is the current population of women that are in pre-release?
I believe based on my data, and I would ask for verification from the team, I believe we have 58 individuals this year that would be eligible for that. Commissioner Harvey, could you please?
Let me go ahead.
She'll need to be unmuted. Thank you.
Yep, 1 second here. Here you go. Go ahead. Commissioner, one more time. Commissioner, let me, it's going to ask to unmute you. Here you go. There you go.
58 is correct, sir.
58. And I'm curious because the legislation, I don't know how you're supposed to comply with the zip code requirement. Is this going to be, was it supposed to be a traveling facility? Because the legislation that the General Assembly in all its wisdom required that it had to be located where the most people were from. So how logistically do you deal with that? Because if you've got, let's say, Baltimore City is number 1 year, but let's say you've got Montgomery County another year, how are you supposed to comply with that?
Thank you for that question, Senator. That'll be part of the phase 1 planning that we'll work with our DGS colleagues and a consultant to help us determine that. But you look at the data, as we've noted, 2 years ago, we moved to a reentry through and to the local communities where an individual is going to be living and thriving. We currently have no standalone men's pre-release facility. Our pre-release men's pod, we've closed both of those facilities. Those individuals are housed with home detention or other programs inside minimum security facilities. And we work very diligently now to try to relocate individuals and to the place of their home plan, Senator. But we're going to seek to comply with the legislation as it is written and look at where individuals are returning to. But you pose an interesting question, Senator.
Yeah, and just a follow up. So the policy for men right now in the state is going to be, if you're from Frederick County, you say we're basically doing home detention, and we are putting you in closer where you're going to go to work, where you're going to go to school, putting you back into society. But it seems like this policy now on the women's facility, we're going back to centrally warehousing people in one facility, away from their homes, away from where they're going to work, away from schools. And it just seems to me this capital proposal is going to take us backwards as far as the idea of lessening our prison population, putting people, integrating them back into society, back from their homes. And instead, we're going to be warehousing everybody from a central facility, let's say in Baltimore or wherever. And if they're from Frederick County, men will have if you're arrested and you're serving time from Frederick County, you're gonna have a much better chance because you're gonna be on home detention and doing your programming. Whereas if you're a woman, you're gonna be on the other side of the state. Am I missing something?
Thank you, Senator. We're going to endeavor to comply in full with Senate Bill 684. We've had the statutory authority to move individuals into home detention for years. We have expanded that catchment area, as many of you know, used to be right around the Baltimore City area. So we have people returning back to their communities from mountain to shore. And I would be remiss that we also have a secondary opportunity that we are discussing and have been discussing with our local colleagues, Ms. Thompson, who is representing them, about also utilizing return through local facilities and programs for individuals. But we've really just not been in a position to do that with their COVID numbers.
Yeah. Well, I just, you know, I wish the General Assembly would reverse this. This is what happens when politics overtakes good policy. And this was just a terrible policy that's going to lead to women further incarcerated, warehoused in one facility when men are going to have be located throughout the state, integrating back in their communities with programs in their communities. But thank you very much.
Thank you very much, Senator Huffman. I mean, you do bring up a good point with respect to the allocation of where the folks are from. You had a chart, Secretary Green, of currently where the women are from. The majority are from the city at the moment, right? And you've got 5 or so that have outside the state addresses, and then I think what was the second largest jurisdiction represented in that
Chief,
chart?
if we could put that chart up, please, or provide that information. Chief Sessa?
Sure, I can go ahead and in terms of the breakdown of that information. So right now, again, this is the projected releases for fiscal year 2022, and recognizing those home plans do change over time based upon the ever-changing release date as individuals earn diminution credits or become parole eligible, or there is a sentence modification. So it is captured. It's a point in time in terms of our dashboard for those FY22 projected releases. And at the time of the publication of the dashboard, 15 of the individuals that are returning home, projected to return home, or have a home plan identifiable in Baltimore City, 8 in Baltimore County, with an additional 5 that were pending the home plan. Again, these are the projected releases. In terms of the current number of individuals that are women who are classified as pre-release, it's actually 62. But again, those projected releases do change over time. So I think it's approximately 12% that have identified a home plan in Baltimore County at the time of the dashboard, with another 13.45% yet to have determined their home plan.
I know this is a snapshot in time, and as Senator Huff has mentioned, it's a moving indicator. But the question is this snapshot reflective of historical trends?
There was history when we first, we'd have to go back and really, I think, to establish history, we would probably need to go back to 5 to 7 years and look at that, and we can have our data manager put that together. But I know in 19, it was a different zip code that was actually would have been the designated area.
Got it.
We'll seek to comply, but I think to your point also, Senator Huff, we will continue to utilize the home detention model and placement. It's a good model, and it's serving I think those going home well. And it's been in our ability to do so for many years. So we're going to continue that model as well while we pursue full compliance with Senate Bill 684.
One of the many lessons learned and innovations out of COVID is, and I think that's a good, maybe potentially a good lesson to capture there. So I hope that it's expanded as well. Anyway, Senator Carter, you're up.
Thanks, Mr. Chair. So Rachel or Secretary, Deputy Chief or Secretary, I'm not sure that I fully understand, so bear with me. So you said about 62 women are currently classified as pre-release eligible. So my questions around that are there women that are not classified as pre-release? Is the lack of a facility impacting some women in terms of keeping them from moving forward with that classification and the transition home?
Thank you for that question, Senator. And I'm also going to loop in Deputy Secretary Hill and his case management experience. But I would tell you that classification is not defined by location or solely by location or building. Deputy Secretary.
Thank you. No, pre-release is a classification status that is hinged upon a couple of things. One of them being the release date of that individual and the programmatic options available to them. So you may have a man or woman who are within 5 years, 4 years of their release date, and they have met all of the other criteria, adjustment history. They participated in programming. They've done all those things that will then make them eligible for pre-release status. So it is a status within the facility that they earn this, I guess, this classification.
We have individuals, Senator, that are on pre-release status that will not go. I think I'm trying to think the best way. It's not a place. It is a status. We will have individuals that reach pre-release status that are in a maximum security facility, but we're also going to be transitioning because it's statutory that they would move out of our system. So we're going to be working with them as well. When we talk about pre-release just as a singular destination in terms of a space, we have individuals, men and women that are in that status to go out and work in the community, but they come from within MCIW, or they come from within one of our minimum security facilities. They go out to on pre-release status, or they go out to home detention and work out in the community. But people can also reach a status but would not be granted that community option because of other reasons, Senator.
Thank you. And so with respect to the 62, I just want to kind of go back because Senator Huff brought something up, but also at the very beginning of your presentation, Secretary, you talked about the women population trending downward and the most significant reduction. But I can remember some years ago when there was much controversy over the building of a Baltimore City youth detention center, youth jail. And initially it started at some really astronomically high amount, and it was designed for more youth. And then I think at the beginning of this presentation, you said that there are currently 60 youth housed in that facility. And so I want to clarify and verify that the trending downward is not in any way impacting moving forward with the pre-release program, the Prerelease Center. Is that correct?
Thank you, Senator, for that question. It is not impacting that. We had the ability in this budget year, fiscal year 2023, to put the funding in to begin to work with our colleagues at DGS, and we have done so and moved forward. I would tell you, perhaps Chairman Smith, Mr. Reichert, DGS Deputy Director, may be able to provide some perspective around that piece.
Excellent. Mr. Reichert.
Yes. Could I have your question again, please? To be sure that I clearly have it.
So, we passed this legislation. We're very committed to making sure that women are afforded this opportunity for adequate pre-release programs, adequate pre-release services, and whatever they need to transition back into society. But I'm concerned that, one, Senator Huff mentioned the lesser number of women that are there. And I was worried because I want to make sure there's no chance that the trending downward, the numbers being lower, is impacting the motivation to get this done.
Well, Senator, thank you for the question. The funding is in the budget. If it's approved, that will begin the program to start doing a part one. As you know, any capital project does a part one and a part two program. Part one will be to work up what is needed in terms of the program, the facility, that's the type of facility that's needed, the location, and what services need to be offered out of that facility. That will all be done in conjunction with Secretary Green's office to actually define what the programs and needs are. And then phase two, of course, would be the actual request for funding to actually begin a construction based on the phase one, which will include, when the phase one part is finished, it will include the what type of facility, the size of the facility, and so forth would be needed. But that will be in the phase one, and then phase two, like you say, would be actually funding for the budget in the coming year.
And what is the timeline from now until completion?
That will depend on the funding process as it goes through the capital program. Right now, there's the $150,000 to do the part one, which is design, come up with what the program is, what the facility needs are, and how to structure it. And then a request will be put in for facility design funding. So that will be the next phase, would be facility design funding and then construction.
You have to have some type of projection, don't you?
It depends on what it goes through. It takes any capital project that DGS does takes a couple of years to do it, depending on the funding that's available to it and the size of the facility.
Thank you.
Senator Ricardo, I'll pick off where you left off, and just so people understand. I mean, this is good information for all of us to have, just so we have just a basic level understanding of how this process works. So then obviously your phase one money allocation for fiscal year 23. So then that'll kick off phase one. You'll start there. As you just mentioned, it could take anywhere from a couple of years to kind of go through that process. And correct me if I'm wrong. When I'm talking, just chime in. Just again, we're not a budget committee. So does the department have the authority to take money from any other source within its purview to backfill projects, capital projects to meet statutory requirements that are on the books?
We're not able to move capital money around without approval from the capital budget. So we couldn't take money from building a bridge, or not a bridge because that's a transportation project, but from building another facility, let's say a mental health facility for MDH. We couldn't take funding from that to put to this. We're not allowed to do that.
No, I understand. Just like I said, we're not a budget committee, so I want some basic 101 level, just understanding of how things work.
Right.
Understanding. So again, obviously because of the way that the process has played out here, we're woefully behind schedule on this. And that's both a consequence of overrides and vetoes. So like the legislative schedule, but also budgeting. So what other factors have gone into the delay? Can you just help us explain why we're behind? Just a base level understanding of why we're behind. I mean, the secretary outlined the calendar from when bill passage to now, but there's a lot of confusion in the committee about why the timeline we've run afoul of the timeline.
Okay, well, first if I can say, in reading through the legislation, the way it was set up, the timeline was very aggressive to do the project. And that depends there again on budgeting and how the money is budgeted to do the project. Typically, the first year's budget, which would be the $150,000 this year, would be to take this year, this funding, and set up the program, the functions that are needed in the facility. And then the next phase would be, which would be in the next capital year, would be to actually get funding for the design of the facility. And then after the design is complete, then the next phase would be obtain budgeting for actual construction, which going out to bid, finding a contractor to do the construction. So
we're looking at several. I mean, this is a several years long journey that we're on here.
yes, it's none of the projects are a 2-year thing. It takes longer to do that because of the budgeting, because of the money, and because of the time it takes to actually design a facility. Whether we'd be doing a design of a completely new facility or a rehab of an existing facility, it still takes a bit of time. Courtney Lee, who is with me also, probably could give us a little bit of better idea on how long it takes to design and how long it takes to construct.
All right, so I'll click over to you.
Okay, good afternoon. Can you hear me?
We can, yes. Thank you. Welcome.
Thank you, Deputy Secretary Reichert. As he's mentioned, some of the process is that DGS is a facilitator to support the agencies that we help, and corrections is one of those agencies. So we can't necessarily begin anything on our end until we have the framework and an understanding of what the requirements are and funding to begin that. So the framework is partially set with the bill, Senate Bill 684. We would need additional data from corrections to complete a scope of work that we could hire a consultant to bring on board to do the Part 1 or Phase 1 program. And that funding is now identified in FY23. So that's the first step, as Nelson and everybody's aware at this point. So once we have that funding in place, we can work collaboratively with corrections to get to a place as the funding becomes available in July of this year to be able to bring that consultant on as quickly as possible, so we can try to run some parallel paths as we wait for the funding to hit. Once we have that consultant on board, the Phase 1 part is probably going to take about a 6 to 8 month time frame to go through that, to digest the bill, to work with the consultant, to use the data that corrections has to be able to identify, potential locations for a facility, what the facility is going to look like, and the needs and the requirements of it. With that Phase 1 or Part 1 done, then we, corrections and DGS, would be able to confer with DVM to put money in upcoming budget cycles to fund additional design, acquisition, and construction. So as Nelson's mentioned, I mean, this is a process that doesn't happen overnight. So Part 1 or Phase 1 programming is a 6 to 8 month timeline. Design a facility like this is probably going to be a 12-month time frame. Then you have solicitation for bids, which is going to be 4 to 6 months. And then you have construction, which most likely will be 18 to 24 months on a facility like this, depending on whether it's a new construction or rehabilitation of an existing facility. So that said, start to finish, just ballparking here, I would say, 3 to 4 years total from when we have the initial round of funding to begin the Phase 1, Part 1 programming to completion, if the budget is there to support the rest of the steps that are needed. So that's just kind of a ballpark at this time, what it would look like. And again, it goes back to location, what the consultant says is necessary for this facility based on the bill and what corrections has as data. And I think it's a very good point that you brought up early, Mr. Chair, about using historical trend data to identify what the pre-release zip codes were previously over the past 5 to 10 years. All that information will help feed this Part 1 program to identify the most logical area that is would benefit from this facility.
Excellent. Thank you for that context. And so two last quick questions to wrap up this line of questioning. One is, so the statute required just a progress report. I think the last report was supposed to be submitted to the General Assembly in December of 2021. Just want to know the status of that progress report, and then who within the department is responsible for ensuring that we're kind of meeting these benchmarks. Obviously, it's been a sliding scale here, but so progress report, and then individual responsible for kind of overseeing compliance with the statute.
Thank you very much for that question, Mr. Chair. We did not meet the deadline on the progress report, and the committee has our apologies on that. We have established a deadline, February 15th, to assure that progress report goes through the proper channels and is presented. By statute, Commissioner Harvey, this would fall within the Division of Corrections, so will fall to the command of Commissioner Harvey, and we will have all that data ready to go along with the funding.
Excellent. Thank you, Mr. Secretary. Turn back to the committee for questions. Senator Carter, go ahead.
Thanks, Mr. Chair. Please bear with me. Like you said, we're not the budget committee. So you mentioned a few times that the first allocation of funding, the 150,000, was for the preliminary phase. And then the next phase being the design phase, you say that's in fiscal year 23. What's that amount? Do you know?
I'm sorry, Senator, that question for me or for Mr. Reichert?
Whoever.
Unmute Mr. Reichert.
I understand that this is, you've got your plans in different phases, but you're also going to need funding in different phases. So my understanding is we're kind of on the second phase, you call it the first design phase. So there's a second allotment of money in the fiscal year 23 budget, correct?
There's $150,000 in the FY23 budget, which will be used to set up that first phase of developing the program and the project. Then we'd have to request funding in FY24 for the design of the facility.
I got it. That's why I was confused, but again, it's not my thing. But I could have sworn you said earlier, the first allotment was fiscal year 22. So that's why I thought we were moving beyond that.
Oh, no, there was, with the money was just put into the budget for FY23 to start the project.
Okay.
There was no money in FY22. So FY23 will begin the first phase of the project. And in that, once we define what the programs are, we'll be able to better figure out what the cost, what will be needed in FY24 for the design, for the actual design of the program.
Okay, I got it now.
Okay. Sorry if I misled you.
All right, excellent. All right, well, this has been a round robin of questions. I'm looking around the committee for additional questions. May have some more questions forthcoming in writing that we'll submit as members have additional inquiries. But I do want to just take a moment to say thank you all very much for your time and for your attention to us and for answering our questions and for being a resource as we move forward. So look forward to working with you in the months to come. And just want to say thank you, Mr. Secretary. Always a pleasure. And with that, if there are no further questions, that'll conclude this briefing. No questions. Okay, forever hold your peace. Thank you all very much. That'll end the briefing. Senators, we have a voting session.
No, Chair Smith, I do believe that there's another presentation.
Sorry, you're absolutely right. Excellent.
The Maryland Correctional Administrators Association.
Sorry. Ms. Thompson, you're up.
Good afternoon, everyone. And I will try to keep it short. If I can go to the next slide, please. The Maryland Correctional Administrators Association was formed in the 1960s by a group of wardens to advance the corrections profession by proposing and commenting on legislation, developing and implementing community programs as alternatives to incarceration, and to inspire advanced levels of knowledge in the various elements of corrections throughout the state of Maryland. Next slide. Local detention centers are operated individually by the respective county and are operated independently as well as funded by the local county governments. Inmate healthcare and behavioral health services is the most costly contract at the detention center. In St. Mary's, the medical contract is over $1 million. Today's presentation is in reference to COVID-19 and medication for opioid disorders. However, it would be remiss not to set the stage of the entire picture of healthcare in local detention centers, as well as offender reentry, which is an integral part of medication for opioid use disorder. A notable accomplishment of the pandemic, as Secretary Green already stated, is the biweekly virtual meetings between the local wardens, Secretary Rob Green, Department of Public Safety and Correctional Services, and Dr. Cliff Mitchell, Maryland Department of Health. Partnerships with the judiciary, health departments, and countless others, too many to name, and when names will be invariably missed when I start naming. So I apologize if I missed anyone. Next slide. No two jails are alike in Maryland, and this applies to healthcare to include behavioral health. Some local jails have 24-hour coverage for medical staff, while others do not. Not only do the hours medical staff coverage vary, but the levels of licensure as well. For instance, some jails have registered nurses around the clock, while others have certified nursing technicians with limited coverage, and the shift supervisors are administering medication. On-site healthcare services include, but not limited to, medical professionals, pharmaceuticals, x-ray, and laboratories. Mental health services are very similar, wherein there are the haves and the have-nots. Some have full-time Monday through Friday, and others part-time. With jails becoming de facto mental health institutions, it is quite a challenge to say the least. COVID-19 and medication for opioid use disorder require significant amounts of resources, both funding and staffing. Next slide, please. In regards to the challenges, the country song lyrics, "Come as you are, there is no dress code," comes to mind. When arrestees come to us, they are often at the lowest points of their lives. Healthcare and behavioral health services are critical to the inmate population. Basically, you name it, local jails have encountered it. For years, jails have been de facto mental health institutions. During the pandemic, mental health cases coming to the jail doubled, and it is not uncommon to have inmates on suicide watches, which are necessary, however, require staff to be in constant motion. Next slide, please. If you've ever seen the movie Blindside, there's a scene with Michael Orr sleeping on his friend's couch. The technical term is couch surfing. It is very much how many offenders live, and it makes it extremely challenging to arrange housing or for them to qualify for services. By definition, it does not deem them as homeless because they have a place to live, albeit at the mercy of others. Another challenge is inmates will unexpectedly be released from court, and the timing of a bed and transitional housing is not available. So the offender is released without a safety net of a place to live. It is no wonder they revert to their previous lives if there are not community services. Lastly, one of the biggest challenges in corrections has always been for officers. However, the pandemic has created staffing shortages of medical, mental health, and substance abuse counselors. Next slide. One of the most intense times of my career has been the pandemic. As an administrator, you are charged with the responsibilities of not only your personnel, but also the inmate population, which is considered congregate living. The challenge continues as the reality is those coming in our back doors and employees coming in our front door pose a significant threat of bringing in COVID-19 to the inmate population. While it was always important to have a good working relationship with your local health department and medical care provider, COVID-19 elevated the partnerships to a new level. We so appreciate the guidance provided by the Maryland Department of Health and our medical and our mental health providers. Their continuing support as the pandemic continues is invaluable. The Maryland judiciary has been critical in keeping our population safe by allowing cross-designation for bail reviews and virtual court hearings. Mitigating the risk of transport between the facilities for a bail review has been very successful. Working smarter, not harder, increasing safety for all. Next slide. Let me preface by saying St. Mary's was a pilot program, and we wholeheartedly support medication for opioid use disorder. However, the funding has been slow to filter into the jails. Last week, the Opioid Operational Command Center advised of grant opportunity to medication opioid use disorder, which will allow counties may apply by March 21st with an award of April of 2022. Medicated assisted treatment, like with other recent legislation, requires reporting statistical data. Data collection and reporting is a challenge for local jails. Quite frankly, the jail management systems are not set up to collect the data being mandated. No monies are factored into House Bill 116 for the cost to change jail management system to collect the data required. And House Bill 116 is more than just medication. It includes programming, and physical plants are not designed with the classroom space nor the offices for full-time program staff. Next slide, please. Medication diversion in local jails has always been a concern, with the inmates hoarding and sharing medication. However, with medication opioid use disorder, the prevention of medication diversion is critical to prevent overdoses. For some inmates, it has become a game to beat the system. Anyone who is clinically diagnosed with the opioid use disorder is eligible for medication-assisted treatment. Nevertheless, there are still some offenders who do not want the stigma and want to beat the system for the thrill of getting away with it. They will badger the inmate to divert medication to them. I know it doesn't make sense to me either, but to have an overdose in the confines of the detention center could be a reality if the medication is hoarded or diverted. Next slide. Even with its challenges, medication for opioid use disorder is the right thing to do for our communities. In addition to St. Mary's, Allegheny, Howard, Montgomery, and Prince George's have implemented with other local detention centers on the horizon. The grant funding by the Opioid Operational Command Center provides an excellent opportunity for funding. Using St. Mary's as an example, with grant monies, we are able to obtain the services from the local methadone clinic, medication, a registered nurse to be able to have nursing staff on the weekends to administer medications, a substance abuse counselor, transportation costs, and so on. Thankfully, there were already grant monies for peer recovery specialists. The offering of the 3 formularies is a great challenge. Buprenorphine and Vivitrol are easily completed on site. However, offenders have to be transported off-site for methadone, which is a huge drain on staff resources, as well as an increased liability for transporting off-site. Another challenge for the off-site services is offenders' Medicaid stops upon incarceration. So for the methadone clinic, who is used to charging insurance billings, becomes complicated. Next slide. Bail reform had a powerful impact on the pretrial supervision programs, and with the pandemic, community corrections has taken on a greater role. Community programs include rehabilitation and behavioral health needs of the offender. For the incarcerated population, more now than ever, the judges are authorizing inpatient treatment programs while offenders are incarcerated. Offender reentry is a component of Medicaid assistant treatment program, and for all offenders as they reintegrate back into society for a continuum of care. Again, inmates are not eligible for Medicaid or insurance while incarcerated. While it is understood it would be a federal law change, it would be a huge help if an inmate could continue Medicaid from community to incarceration. Next slide. Community corrections during the pandemic has been a lifeline, not only for offenders and their families, however, reducing the number of incarcerated. There are currently 16 counties plus Baltimore City with pretrial programs of varying degrees. 15 local detention centers have home detention programs, and currently 1 day reporting program. And St. Mary's received grant funding, and we're projected to begin day reporting in September of this year. Community corrections programs have been invaluable to our community as offenders. Many for the first time are clean, remaining employed, establishing themselves in community programs, and restoring family ties. Next slide. With grant funding through the CARES Act, Governor's Office of Crime Prevention, Youth and Victim Services, and the American Rescue Funding Act, local detention centers were able to mitigate risk in their facilities. The slide gives a sampling of the types of great innovation utilized with pandemic grant funding. The usage of technology has been so invaluable in mitigating risk and assisting keep our facilities safe, and the judicial process, inmate programming moving and evolving, aiding in offender reentry and ensuring inmates' legal rights are met. Next slide. To highlight a major grant initiative in corrections, we are used to doing a lot with a little. Our detention center opened in 1989. Even back then, inmate education opportunities and religious programs were provided. However, the facility was never designed for the types of community and offender reentry programs provided today. And with COVID-19, staff had to be put on telework because the office spaces were not large enough. It cannot be overstated how closely staff were working. In public service, we were used to being told no. Believe it or not, a community corrections center had been envisioned 4 years ago. However, there were no budget monies. When the county was figuring out how best to spend the CARES Act grant monies in late May of 2020, the modular was proposed and submitted. Thereafter, the county administrator worked with the county health officer, and the county and state pooled their money for our community corrections center. Not only was this a joint project, however, we were able to occupy within a year. Miracle in government world. Thus, the Community Corrections Center groundbreaking was held in May of 2021. Officers and civilian staff were able to be brought back from telework, and pretrial supervision and home detention center staff moved in. Community corrections is truly the way of the future for the best possible outcomes, reducing the numbers in traditional incarceration. And I would like to add that we do, on a monthly basis, we do what's called a one-stop shop, where we bring our pretrial supervision, we partner with parole and probation, and we bring the offenders in, and they're able to receive services, not only for, to meet with their parole agents and with our pretrial supervision, but we're able to partner with the county library so that they're able to get resources. We also work with our local substance abuse. So it's one day that they are able to meet all together. Next slide. It is important to remember, if you have visited one jail, you've only visited one jail. Local jails are not equal with budgets, staffing, physical plant, and so on. At the end of the day, local jails are the places to effect positive change in offender lives. Offenders will be returning to a neighborhood near you, and it's the community's best interest for the offenders to be set up for the best possible outcomes. Thank you very much for the opportunity to present. And the next slide is just my contact information if anybody ever wants it.
Thank you very much, Ms. Thompson. So you almost got off the hook there, so my apologies right there. This is a very, very informative presentation. Appreciate you taking the time. Switching over to the committee for questions, we got saw Senator Sidnor first, and I'll go to Senator Hedelman. Senator Sidnor, go ahead.
Thank you very much, and good afternoon. Just one question. On your slides, when you were talking about CARES Act money, I think the slide mentioned an RFID management system. I was curious I was wondering if you could explain that. I mean, what RFID, are they being put in clothing, or what is that about?
Well, how we do it in St. Mary's, and others do it with wristbands. But what we do is we developed a ID card, which also has the RFID chip. And the beauty of the identification card is we also use that. We partner so that they can go to like the Department of Motor Vehicles, and they can go over to social services. So it is an ID that is accepted for them to get services in our community. But in the jail, so that way, like Mary Ann Thompson is the inmate. So if I move for services, you swipe, you make sure who I am before I get medication. It also, if I move through the facility for programming, we also use ours for like cell searches. We use it with our medical, in conjunction with medical. So it's a very, very powerful tool. It's very, very good for restrictive housing to make sure, like for your 15-minute watches, we're set up so that we can track to ensure that suicide watches are 15, or 30s, or 60s, perimeter searches or checks. We're all monitoring that in real-time data. I can check it from my house.
No, when I saw that, you got my mind thinking, so thank you very much.
All right, Senator Hedelman.
Thank you very much for this presentation. I know many years ago I visited down in St. Mary's, and you guys have always been sort of at the cutting edge of pretrial services. So I do appreciate hearing from you. I caught something, but I want to get clarification. You said something about needing a federal law change, and was it to continue medication assisted treatment outside the walls? Is that?
It's basically to keep Medicaid, because what happens is when you hit the door, it stops. And, we kind of explored it a little bit through MCAA, but it would be at the federal level. So it's way above our pay grade. So to be able to do it, not my pay grade, not y'all's.
Do you know that if there is an effort afoot in Congress to change that?
Not that I'm aware of. I just wanted to put a plug, because it would be so very nice, because it would be a continuum of care. And not that we don't do everything we possibly can to make sure everybody has Medicaid when they leave, but it would be a nice.
Okay, thanks for flagging that. Thank you.
So thank you, Senator Hedelman. Looking around the room for additional questions from the committee. Seeing none, thank you very much, Ms. Thompson, and my apologies for that, but thank you for your presentation. If you want additional information, we've got your contact information and the slides as well, so I appreciate that. This is great.
Thank you so much. I appreciate y'all's time. Y'all have a good afternoon. Thank you.
Thanks, you too. All right, JPR, we're gonna do this. Let's do voting down here in the committee room at 3:15. So we're 3:15 to departmentals, should be famous last word, but should be less painful than a normal voting session. So I'll see you all soon. All right, thanks.